Hi, everybody. Thank you for joining us today for the Digital Transformation Healthcare discussion. My name is Kenan Rooney. I'm going to be facilitating this discussion with my colleague, Sachin Dev, who's going to be doing a lot of this presentation. There's a lot of material to cover today in a good way. Okay, and so we want to be able to have you participate because there's a lot of details in here that you might have a lot of questions about. Use the chat function. Right now, I've got you all muted. If you raise your hand, I can unmute you, or we can hold Q&A at the end also. But the main thing is really getting some value for you out of this discussion today. Just so that you know, today's program is being recorded. So again, submit your questions via chat. We are offering CPE for this event. So there are 3 polling questions during this. So answer the polling questions and participate during this, or stay for the duration. And then at the end, we will send you a CPE certificate if that's what you're looking for, as well as a survey for this webinar. So with that said, I'm going to turn it right over to Sachin, who's going to start this webinar. Sachin?
Right. Kenan, I believe we have a polling question first.
Great. Yes, we're going to start with the polling question. So you guys, start kicking right off with the polling question. Do you see the first one? You see the question?
Do I think it's all 3 questions together. So.
Yeah, but what's the first question? Oh, you guys, I apologize. I don't know why all 3 questions are doing this, but can you answer one of them, the first one? What is your organization level of digital maturity? Are you able to answer those? Sachin, can you answer?
Yeah, I cannot answer that.
Great.
Just being a host, but
Yes, Alex, thank you. You guys answer the question. So what is your organization's level of digital maturity? 1, no digital initiatives. 2, some digital initiatives, but not fully integrated. 3, moderate digital integration with defined processes. 4, advanced digital capabilities with continuous improvement. And 5, highly advanced digital transformation and innovation.
And Kenan, it looks like the participants may have to answer all the 3 questions before they can actually hit this submit button.
You guys, here, I'm going to tell you a story. Our ops person was out the last 2 days, and I had to do this, and clearly I messed it up by putting all 3 in one place. So if you can just answer these questions, we'll get to the other ones in a second when we get to the polling questions. So thank you for continuing to answer. So let's just show the response to the first one, you guys. So a lot of you, it looks like, have started the digital initiatives, which is fantastic. And you can kind of see it's spread out over some, moderate, and advanced, which is really great for some of you in this advanced stage, because a lot of these digital, you'll hear from Sachin talking about this, these are pretty comprehensive. So Sachin, let's go ahead and get started. I apologize, everyone, for the polling.
Thanks, Kenan, and welcome everyone to our today's webinar on digital transformation. In this webinar, we'll be exploring some of the use cases of the digital transformation in the healthcare and the opportunities they present for your organization. As we all know, from the rising cost to changing patient expectation, the healthcare industry is under increasing pressure to transform its operations and deliver exceptional care. And this is really where the digital transformation comes in as a catalyst for innovation, efficiency, and improved patient outcomes. So what you're looking on your screen here, and before actually I dive into that, just very briefly, this webinar is first of our 3-part series of discussion on digital transformation. And the focus of this session will primarily be on artificial intelligence and automation. So, on this slide, if you're looking, I think, one of the big thing that happened just recently is the end of the public health emergency. And it may not sound like as big, but when you look at the implications Kenan?
Yes, you paused for everyone. You're back. Go ahead.
Oh, sorry about that. Can we move on to the next slide, please? All right, so I think, on this slide, what we try to do is break down the impact of the expiration of the public health emergency on the hospitals, long-term care, and the SNFs. So when we look at this slide, it's really important to note that the impact of the public health emergency expiration on the hospital, it could vary considerably depending upon the nature and the type of services provided. But here is a list of some of the changes that will require the hospitals to recalibrate in this new or now so-called never normal phase post-pandemic. So the first and the big thing that you see on your screen is that for almost 3 years, hospitals were exempted by several payers to either secure the prior authorization or secure the authorization in the contracted timeline. But with the end of public health emergency, hospital and surgical centers will now be required to secure the authorization prior to rendering the service. Request will be subjected to the medical necessity review, and hospitals, they need to be prepared to see another round of increase in denial. So again, left side of your screen, prior authorization requirements are back. And we know that, the last 3 years, many hospitals, they have rolled back and made significant system changes to accommodate this waiver. But now they have to spend a lot of time and put significant work to be able to bring those requirements back and be able to fulfill those requirements in a timely manner. And just to give you an example, how does it impact the providers? The denials actually rose to 11% in 2022, which is up by nearly 8% when compared with 2021. So they were hovering around 3% in 2021. So I think, when we put this requirement into the mix, the denials that were related to the prior authorizations were not among the top 5 reasons for denials in the last 3 years. So with the rollback of the prior authorization requirement, many hospitals will now need to change their workflows and will probably see a significant increase in denials due to the lack of prior authorization or incorrect prior authorization. So that's a big one. It has both the financial implications as well as the implications from a care delivery standpoint. So when we move on to the next column, CMS during the public health emergency, they waived the MTLR requirement, which basically means that the patient could have been screened at any location outside of the hospital. But again, with this expiration of the public health emergency, the hospitals will now be required to triage and screen the patient on site. And that creates a lot of logistics issues around ensuring that all the requirements are met to be reimbursed. And then the last one really is return of the walls between the excluded unit. So what does it mean? CMS requires to allow hospitals to house acute patient cares in the excluded and distinct parts of different units. So in other words, the patient, med-surg patient could have been treated in a psych ward or rehab ward. But with this expiration of public health emergency, now the patients must be treated in the designated unit to be able to get reimbursed. So again, a huge implication from a financial standpoint, and it's going to require a lot of work and different technology components to be able to fulfill those obligations and get reimbursed. Kenan, if we move on to the next slide, please. Similarly, I think, when we look at the long-term care facilities, 3-day prior hospitalizations are back, which basically means, post-discharge, if the patient doesn't have a 3 days of inpatient admission, that patient wouldn't qualify for a long-term care or a SNF coverage. So that was again waived during the public health emergency, but with those requirements are back, we can again see a significant increase in the denials, especially for some of the medical conditions like chest pain, the GI medical conditions. They typically require some sort of a long-term care or post-acute, depending upon the age and the severity of the patients or their medical condition. this is going to have a big implication on our healthcare system. The next one is state and nursing homes. They'll be required to conduct the pre-admission screening criteria, which is again, was waived under the public health emergency. And then there are some additional requirements for the SNF beds, that was not part of the public health emergency that are back for post-acute discharges. So again, huge implications, from a long-term care standpoint. Can I just the next one? So health and hospice, no exception. I think one of the biggest change here is that, during the public health emergency, many of these patients, they were treated via telehealth and remote patient monitoring. Now, those are going away, and the Medicare patients in particular, they can't be receiving those telehealth communications, remote patient monitoring with expiration of the public health emergency. Secondly, the comprehensive assessment will return to the 15 days completion requirement. What does it mean is that, it would be a more frequent assessment that would be required by the home health and hospice agencies to be able to get reimbursed. And lastly, last but not least, I think, during the public health emergency, there were many non-core services that were offered to the patients while in the hospice care or in home health. And again, they are going away, because if they are done today in the home health or hospice environment, those will not be reimbursed. That being said, Kenan, if you move on to the next slide, please. And by the way, I was looking at the list of the participants, and it looks like we really have a good mix of payers and providers and long-term care folks on the webinar. So I just wanted to make sure, again, as we kind of dive into the technology trends, we are aware what could potentially be some of the implications of the public health emergency expiration. So again, as we dive into, I'm sorry, if you just go back. So as we kind of dive into some of the technology trends, we wanted to narrow it down to a point where payers and providers, they can use these trends to, number one, keep the lights on. It will help them sustain the progress they made during the pandemic. We want to make sure also that they are prepared for uncertainty and keep cost control levers in place. We also wanted to ensure that they leverage technology for safety by design, provide patient-centric care, stay in compliance, and agility, resilience, and scalability. So as we kind of go through these trends, those are some of the key themes that we use to handpick some of the top trends. Again, there are a number of different trends, but we want to make sure that we stay very laser focused. And through this webinar, we deliver some of those trends that are really going to have a meaningful impact on your organization and will eliminate all the hype that we are seeing in the industry across both on the payer and provider side. So with that being said, Kenan, if you, next slide. So on this slide, as we examine the aftermath of the public health emergency and its impact on the healthcare system, these are some of the trends that rise above the rest. They demand attention, they demand strategic response. These trends, they do have a potential to reshape the patient care, resource allocation, financial sustainability, workforce management, and long-term strategic planning. Therefore, we wanted to acknowledge these trends, and these will ultimately help proactively navigate the changing landscape and ensuring the ability to deliver exceptional care and lower the cost. So what are some of these trends? First one is generative AI. Many of you probably know this in terms of ChatGPT. So there's a lot of hype. There's a lot of material already on the internet, that you may have come across. And when we kind of look at this trend in particular, we do see that there is a significant hype involved in that. So again, the goal of this webinar was really to kind of drill it down to some of the use cases in which you as a payer or provider can see a significant and meaningful return on investment. The next one is the hyper automation. And we're going to kind of bring it back a little bit in a context where, you know, we don't want to kind of limit the scope of our discussion just to the bots. But again, intelligent automation is a component where, in addition to the robotic process automation or bots, you're also leveraging different technologies such as artificial intelligence, machine learning, NLP, all together to be able to get, again, the best return on your investment. Predictive and prescriptive analytics. I think, you know, we still have majority of our healthcare organizations, both from a payer and provider sides, pretty much still kind of working more so for around the descriptive analytics. And I think, you know, with the appetite, with the interest, with the value that we have seen among some of our clients who have implemented and kind of took a step further, that predictive and prescriptive analytics is really the next level of maturity in the data and analytics space. So again, you know, that's one of the big top trends that we are seeing a lot of interest, and especially with the AI, the maturity of the AI that we have seen, it's really kind of puts us in a very good spot to be able to notch it up and take it to the next level of predictive and prescriptive analytics. On the right-hand side, you're looking at the patient-centric care. Again, you know, most of the time we get asked, well, this is something we've been doing this for years, so what's new? You know, I just recently read a New York Times article, and the heading of that article was, their baby died in the hospital and came $250 bill. So what does it tell us? You know, when the other aspect is, you know, when we look at some of the price transparency regulation, I mean, healthcare is the only industry where we don't know the cost of the healthcare or the healthcare services upfront, and then we have to typically deal with a surprise bill 3 months or 4 months down the road. So again, there's a long way to go in the patient-centric care, and that's again one of the trends that we would like to highlight in our session. And as we kind of continue going through that list, digital care and personalized care. So again, a very broad topic, which we actually going to cover in our upcoming webinars a little bit in more detail, is around how to create an ecosystem using the remote patient monitoring devices, telehealth altogether, to be able to create a digital first care. And it's not only from a clinical or the care delivery standpoint, but it goes all the way from managing some of the administrative tasks, like auto scheduling, self-scheduling capabilities. And then lastly, workforce management and streamlining operational efficiencies. So these are really some of the big trends that we are sort of seeing across the industry that we will be highlighting some of them in our today's discussion, and then eventually down in our next webinars as well. But for today's discussion, I think we're going to limit the scope just for the first two top trends. So Kenan, if you just don't mind moving on, next slide, please. So the first recommendation is, you know, be an early adopter of generative AI, but make sure that you identify the right use cases and those with a meaningful ROI. So healthcare companies, they are racing to incorporate generative AI tools into their products with the promises to perform many tasks faster, cheaper, and sometimes even better than human. But again, you know, when we kind of look at if your organization is trying to be among the early adopters, the first step you ought to be assessing is how generative AI will transform your organization's ability to develop more intelligent services. So you have to assess if your AI is explainable today, and if not, is it the technology? Is it the process? Is it the skill, or any other issues? So once you go through that assessment piece, typically, I think, you know, there are 3 steps that we recommend our clients to take, you know, before start investing into this technology. First, outline the key technologies that will have significant impact on your operations, and socialize with the stakeholders and arrange meeting to discuss specific areas. You don't want to go with this technology blindly. We want to make sure that, you know, you have a buy-in from all the stakeholders. This is something that has been socialized, and it does indeed going to have a meaningful return on investment for your organizations. So in the step 2, you identify 3 to 5 use cases that will have significant impact on your organizations. And that could be in terms of care delivery, lowering costs, improving revenue, or quality improvement. And rank them and then start with a small, short-term POC. And as you kind of go through that process, the step 3 is really where you ultimately should evaluate the impact of your short-term POC and accelerate the movement into the production. So again, you want to make sure those are 3 basic steps. But what we typically have seen is that, many organizations would invest a lot of money into some of these technology, and then ultimately not necessarily get the anticipated return on the investment. So again, we want to make sure that you follow those 3 steps, and that's going to really help you become an early adopter of generative AI. Kenan, next slide, please. So what we have on this slide is some of the use cases that we have identified through our internal and external research and having through our discussions with our clients. So if you're looking on this slide, and this slide is specific for payers. So the first use case where the generative AI can have a meaningful impact is in the utilization management. As we briefly talked about that, the prior authorization requirements, they are back, and it indeed creates a significant amount of extra administrative work for payers. And therefore, payers in particular, there's a significant opportunity to leverage generative AI by integrating all the medical policies, NCD guidelines, LCD guidelines, and present this information in a very simple format to the members and providers. Similarly, prior authorization request and utilization review teams can leverage generative AI to reference any specific guidelines, such as Milliman or Interqual, to considerably reduce the time required by medical personnel to review the same information manually. So again, the benefit here is to create an ecosystem where you have all your different policies together. Nobody wants to go through a 30-page NCD or LCD policy. Again, you can leverage the generative AI to be able to put or present that information in a very simple format, and then that could deliver a significant return on investment in terms of your cost savings, FTE savings, so on and so forth. So the next area here is the claim processing. Again, generative AI can assist payer in automating and streamlining the claim processing workflows. So by analyzing claims data and medical records, AI can accurately extract information, validate claims, identify potential fraudulent activities, and can reduce manual effort and ultimately improve efficiency. So that's another good use case to consider as you're kind of going through your journey in generative AI space. Provider network optimization, that's another great area. So generative AI, it can track your resource utilization. It can identify trends and variations in healthcare access. And therefore, it can provide us very valuable insights to optimize your provider network. Again, these are some of the use cases that we believe that going to have a meaningful, significant return on investment. But again, some of these use cases may have some different variations. And again, we're going to cover later in the presentation how to kind of use the force multiplier to be able to get the best return on your investment. So the next one we have here is the fraud detection and prevention. So again, paying fraudulent claims can be a significant financial burden for payers. So generative AI can help detect patterns, anomalies in claims data, flagging suspicious activities. So again, that's a great value. One thing I'd like to point out, and I'm sure many of you are already familiar with that, but a third of our healthcare spend is tagged as fraud, waste, and abuse in the U.S. So which basically means it does provide a lot of opportunity to be able to minimize the impact of any fraudulent activity or suspicious activities by detecting all the different patterns and anomalies. So again, it could have a significant implication if done right. But again, that's one of the use case we we believe that it's going to be probably one of those early adopters use case that they would like to implement, with the promises that, it already, for some of our clients, I think, it's already paying some return on investment. Again, it's in very early stages to be able to confirm or deny that, this is going to have a significant return on the investment. But again, this is one of the area that we definitely, when we kind of look at the broader healthcare spend, it's going to have a good return on investment. Risk assessment and underwriting. Generative AI can help payer assess risk, improve underwriting processes. It can analyze vast amount of data, including medical records, demographic information, historical claims to evaluate the risk accurately. So again, this enables payers to make informed decision regarding the coverage, the pricing, and the policy issuance. So another good use case. Personalized consumer engagement. Payers can leverage generative AI to develop personalized health and wellness program for their customers or for their members. And AI models can analyze, different sets of healthcare data, including the medical history, lifestyle choices, genetic information, to be able to provide a tailored recommendation to the members. So with that being said, Kenan, just a quick check. Do we have any questions in the chat so far?
No.
Okay, great. So let's move on to the next slide. So on the next slide, we have the use cases for the providers. So the first and the big one that we have is the clinical decision support. Once again, I think, generative AI can be used to develop clinical decision support systems that integrate patient data, medical literature, and treatment guidelines. So these systems can actually help provide evidence-based recommendation to the healthcare, assisting them, making them, making more informed decision about the diagnosis, treatment plans, and medication selection. Patient communication and patient navigation. Once again, I think, this is one of the area with the help of virtual assistant and chatbots. Providers can handle a lot of different customer queries, provide basic insurance information, assist with the policy. This can also help improve customer service efficiency and provide 24/7 support to the customer. The next one we have is the early detection of medical conditions. Very similarly, generative AI can collect and analyze data from all the variables, mobile applications, EMRs, and can identify the trends and patterns to provide personalized treatment recommendation and early detection of the disease. Patient monitoring and anomaly detection. So I think, this is something that, we are already seeing that's happening across the healthcare industry. So you're probably all familiar with the sepsis detection use case. But on top of that, I think, there are many other opportunities in the space of patient monitoring and anomaly detection, especially as we kind of see the more uses of remote patient monitoring devices, and then also the hospital at home care, which I'm sure you all are familiar, but for those who are not, this is one of the new recommendation from the CMS, which, by the way, would be reimbursed in parity with the inpatient care, where you can actually treat the patient at the convenience of their home by hooking up all the different remote patient monitoring devices. There's a lot of literature, that's listed on John Hopkins website, Kaiser Permanente, Mayo Clinic, and there are some really good end results. The hospital rate, when treating the patient at home, has declined significantly in some of the early research. The quality is better. The cost is comparatively 30 to 40% less. But again, that requires setting up that infrastructure around the remote patient monitoring devices and leveraging the telehealth to be able to treat the patient at the convenience of their home. So again, that's another use case where the generative AI from a patient monitoring standpoint could add a lot of value. Treatment planning and virtual nurses, chatbot, something that we already touched on the payer. So it does have implications and benefits for both payers and providers. Next slide, please. So on this slide, it's really to reflect the opportunities for payers and providers to gain administrative efficiencies by working together instead of being on the different side of the aisles, and creating an ecosystem for real-time / direct-to-bill capabilities. Now, this does require, if you're looking on your screen, a combination of different technologies, artificial intelligence and RPA primarily. So, if you're looking in the step 1, all the inquiries around the patient eligibility and verification can be handled by AI and deploying bots. And we already touched, number 2 on the utilization review and the care management piece for both payers and providers. Similarly, by integrating the generative AI with a rule engine with your claim editor, it can also facilitate the claim submission, and then ultimately checking the claim status in step 4, and then ultimately getting a response back from the payer for the claim, if it's approved, denied, or if it's pending. So again, we are really touching on the surface, but again, we can have a whole session on the opportunity that generative AI can bring to help both payers and providers around administrative efficiencies. Next slide, please. So after the generative AI and all the different use cases we touched on, our next recommendation is that extend the value of bots by leveraging hyperautomation or intelligent automation. So when we talk about hyperautomation, what is it? It's a disciplined approach that organizations use to rapidly identify, vet, and automate business and IT processes. It's an orchestrated use of multiple technologies such as artificial intelligence, machine learning, robotic process automation, low-code, no-code tools. And applying hyperautomation is about more than simply replacing vast number of your factory workers or FTE count. So when we kind of, combine the power of bots with artificial intelligence, machine learning, and NLP, that really sort of help us with a lot of different use cases, that have a potential to help with a lot of different gaining different administrative efficiencies. Next slide, please. I was just doing a quick time check. Are we good on time?
25 minutes left.
Okay, great. So on this slide, we have some of the use cases again where, and by the way, this is a little bit more mature than the generative AI. So we already have clients who are reaping benefit of hyper automation or intelligent automation across different areas of their operations. So when we look at this slide, eligibility and verification check, again, no surprise there. Many organizations, they have already automated that process in particular, and it does help with a lot of administrative savings, as well as the manual work that is required to verify the patient. So similarly, I think coverage discovery, that's another area where we have seen, again, a significant impact of intelligent automation. Prior authorization, I know we touched this both under the generative AI for payers and providers, but that's one area that can be fully automated. And we do have some clients who are really reporting some good success. Now, if you were to kind of start off with something, we typically recommend that start small and then go big. So in other words, I think prior authorization is typically categorized as a little bit more complex case because it does need to tap into all the different rules, the LCD guidelines, NCD guidelines. So therefore, if the automation is new for your organization, we typically recommend that kind of starting off with a simple use case rather than a complex use case, and then eventually sort of evolving in that space. So propensity to pay is another one. It's categorized as a simple use case of automation. CAC is a computer-assisted coding, autonomous medical coding. So there are, again, a lot of different vendors in the space who can actually automate the medical coding. So all the way from the 3Ms of the world to the Optum, they have different tools in place. And then we have another list of small vendors in that space. NIM Health is a new one. So they can automate the medical coding. Claim scrubbing, editing, submission, all those three processes can be automated. Collection, claim status, payment reconciliation. So these are, again, some of the use cases for the providers, that from an automation standpoint, when combined with artificial intelligence, machine learning, and NLP, could yield a good return on your investment. Next slide, please. So on this slide, we have some use cases for the payers. So claim validation, verification, eligibility, and reconciliation of the claims, again, can be fully automated. New member acquisitions, checking the eligibility, account setup, and enrollment for the new members. Again, another area that can be fully automated. Member services member services interaction. So retrieving the billing information, processing the address change. So anything that's required to help your members, again, can be fully automated. Provider data management. You can automate your credentialing, provider enrollment, payment integrity, appeals and grievance, which is another area. I think, again, for most part, when it comes to the clinical denials, that's where I think we haven't seen as much success from intelligent automation yet, as we have seen, especially for the technical denials, where there is not necessarily a clinical review that's required. Again, that's one area where we have some maturity, but again, starting small and then eventually adding more denial reason codes to the mix to be ultimately able to achieve the best return on the investment is really the way to go. Few other use cases, pretty straightforward, collecting the premiums from the members, and then utilization management. I think we already touched on that quite a bit. So with that being said, I think, we kind of covered so far the list of all the use cases from generative AI for the payers and providers, and intelligent automation use cases for payers and providers. So I believe the next one is, Kenan, a polling question.
Yes, the polling questions that aren't working, everybody, but let's go to the second question. Here's the results of the second question. So what is your organization's other top priorities for digital transformation? So this is multiple choice. So thank you. We did get a good group of answering here. You can kind of see the results across: enhancing patient and member experience, implementing data analytics and business intelligence, improving operational efficiencies through intelligent automation, cybersecurity and data protection, and investing in digital skill development and training. So you can kind of see across the second and third are the largest hits, with implementing the data analytics and business intelligence tools and improving operational efficiencies in place. So, not a lot of training. It doesn't look like a lot of training and development being put into this investment right now.
Right. So I think with this response, I'm assuming, I think all the use cases that we covered and on our previous slides around the intelligent automation, I think would really be useful, and that also kind of gives us a little bit more idea, I think, for our next session to add a little bit more content from an intelligent automation standpoint. Great, thank you all. So if we move on to the next slide. So I think, in addition to knowing all the use cases, the generative AI and intelligent automation. There are a number of other different factors. Am I still audible? Okay, sorry. So there are still a number of other factors that are required to go hand in hand with the technology investment to be able to get the force multiplier impact on your return on investment. So when we next slide, please. So as you're looking into investing into digital transformation, you want to make sure that your investment in digital transformation is countering the quadruple squeeze. And what is that quadruple squeeze? And this is sort of becoming a more important because when we look at all the macros and micros within the healthcare industry, next slide, please. What we see is that, these are the four areas where we are seeing a significant impact on any investment in the technology. So there are definitely labor market shortages, global supply constraints, inflation, and then revenue and margin decline. So as you're kind of thinking of these use cases, you want to make sure that they sync up with this quadruple squeeze and ultimately help you offset one or more of these areas. Next one, Kenan. You can just go on. I think it's a couple of. So your next generation technology, it should have the right business capabilities. It should support the right function and structures. It should have a flexible way of working, needs to be agile and composable architecture, and then be able to jumpstart. Next slide, Kenan. So I'd like to spend just a couple of minutes on this slide because I think this is one of the common discussion we typically have with our clients. When we look at the industry, there are basically three layers of digital maturity. The first one is really just having some sort of a technology. The second is if you really have a very good and optimized technology. And the third one is really the digital enhancement or digital transformation. And what we typically find from many of our clients is that they are interested in this new technology, all the new hype around the generative AI, the hyper automation, and they do believe that it's going to yield them a very good return on the investment, but they typically don't necessarily have the optimized technology to be able to get the good yield or good return on their investment. So if you're looking at the first graph right in the middle of the slide, what we have seen is that many times the clients, they want to go from a step one, from having a technology to the digital enhancement, and they don't necessarily spend enough time or effort to optimize their technology. And we often get asked, what do you mean by optimizing technology? So what we have used here is a reference from a revenue cycle standpoint. So when we get asked that question, what do you mean by optimizing technology? If you're looking on the right side of the screen, these are some of the self-assessment tools that we typically provide our clients. Just like, is your billing system configured to submit 95% or more claims electronically? This is, again, the very first question. And most of the times what we hear back is no, we still submit about 15 to 20% of our claims as paper claims. Well, that's an opportunity for you to optimize. That opportunity may exist in mapping your payer table. That opportunity may exist in working with your clearinghouse. But again, if you are not sending 95% or more of your claims electronically, you need to first spend some time on optimizing your revenue cycle management system before you can start thinking about incorporating generative AI and artificial intelligence and then intelligent automation. Similarly, I think the next question we have here is, does your RCM system include complete mapping of all the denials? Typically, most of the times when we go for the assessment, we find out that it's majority of the times it's like top 50 or top 100 denial reason codes that are mapped in the revenue cycle system. Doesn't matter if it's an Apex, Cerner, Allscript, Meditech, Athena. But most of the clients that like to kind of tackle the 80 their denial 80-20 rule, right? So map 20% of the denial recent codes, and then it's going to give you 80% of your denials. But again, that's the remainder is still a 20% revenue that is not even captured as a denial. So if you don't know it's denied, you cannot work or resolve or cannot use these technologies to be able to bridge that gap. So again, as we kind of go through this assessment, there are questions, again, for each area. But really the big takeaway here is that the digitalization success is really built on the optimization. So if you have under optimized technology, so our recommendation is before you kind of start investing in your time and money into the digital transformation, you want to make sure you have the right technology and it's fully optimized. Next slide, please. As you're going through the digital transformation, it also does require a change in vision from sustainability to growth. So when we kind of look at the reactive mode, or we call it a sustainable mode, it's very control oriented, minimal input from the stakeholders, very narrow vision, volume centric strategy, passive, compliance oriented, reactive. But again, as you are looking into becoming a digitally mature organization, you want to make sure that your change management and the mindset of the stakeholders is really more of a proactive, or in other words, sort of a growth model centric. And what is growth model centric? More collaborative, direct engagement with the key business leaders, seek active input, broader vision, active, sensitive to risk and reward, proactive, innovative thinking, multiple styles, leverage best of breed tools, technology, RPA, artificial intelligence, machine learning. So again, you want to make sure that there is a discussions and you pretty much have a good change management process in place to be able to enable all the value that you can get from your digital transformation. Next slide. This is sort of my favorite chart. As we again go through the technology investment, we want to make sure that it's in sync with the new reality. Most of the times we hear, we want to do this X, Y, Z because our CEO said so. Well, I think as we kind of look at this list, I mean, that's not necessarily a great validation, so you want to make sure as you're kind of looking into all the different use cases, your digital transformation, that you focus on, the use cases that will ultimately help increase business agility, flexibility, can modernize your infrastructure, apps, increase reliability, availability, increase scalability, and then it's helping you directly with the cost savings and reducing operational complexities. So again, this is one of the chart, that really kind of help you do your thinking. What is important to me? How should I select my use cases? What are some of the areas that those use cases going to have, more impact? So again, this is really the key recommendation here is, as you go through your technology investment, you want to make sure that it's aligned with the best and the better reality that's listed here.
You guys, the last question was about what percentage of the company's workforce comprises external talent in your organization. So just sharing the results of that poll. So it looks like, I'm sorry, that less than 10%, you can see maybe 10 to 25% of your organizations are utilizing outside talent, advisory, interim staffing roles to support your organization.
I think that's a little bit on the lower side, just based on our survey results. But Yeah, if you just move on to the next slide. So I think, as we discussed, this is the era of never normal, which basically refers to frequent shocks, both internal and external, faced by the organizations. And there's a significant need for crisis management. It's always on. So a recent RGP survey revealed that almost half of the executive leaders stated insufficient or inadequate resources as the second most common challenge to their strategy execution. And when we kind of look at this slide, what we have identified is that talent is really the new digital currency. If you don't have the right talent, and even if you have identified the right resources, the right use cases, you have the right infrastructure, talent is really the key that's really going to help you achieve your mission critical priorities. So if we go through this, some of the bullets listed here, this is one of our most recent research, RGP research, and it indicated that investing in reskilling and upskilling talent is important, but it is costly and it's a long process for both employers and employees. Secondly, execution of mission critical projects are seeing a growing reliance on staffing and consulting firms to fill the staffing shortages in their organizations, and that applies for both payers and providers. The average percentage of project team members who are not employed increased from 38% in early 2020 to 42% in 2022. Contract labor and consultants are expected to comprise 48% of the average project execution team by 2024. Fusion or hybrid teams of internal and external talent yield far superior results and excellent ROI for both employees and employers. So those are some of the big takeaways from our recent survey that we did. And one of the things that obviously resonates here is that you want to make sure you have the right talent, and it is okay to have a hybrid team or a fusion team, which is a good mix of your internal as well as external talent to be able to achieve and succeed in the digital transformation. So with that being said, Kenan, I will hand it over to you.
You guys, we have about 7 minutes left to the top of the hour. There hasn't been any questions put in the chat, but if you have any questions that you want to ask out loud, just put your name up and I can unmute you if you have any specific questions. And of course, down at the bottom, sachin.dev@rgp.com. If you have any questions specifically for Sachin, he can answer to you that way. So I'll give a couple minutes here, a minute. If anybody has any questions, want to raise your hand and I can unmute your phone. Okay. Well, very good. Well, everybody, thank you for your time today. And again, apologize for the polling questions, but you still will get, if you don't get the CPE information, just email us back at the, either it's Sachin and he can forward it to me. With that said, Sachin, thank you so much. There's a lot of information here, very much appreciated. And oh, there's a question in here. Here, I think a large issue with AI adoption is how slow we move in healthcare. That's a very good point, Alex. That was just a comment, but yes, sadly, that's a sad state that we've heard with a lot of our clients. So with that said, you guys, thank you so much for your time today and have a great rest of your day.
Thank you all.
Thank you.